All right, welcome. In this explainer, we're going to do a real deep dive into the NAN formula. We're talking about the nuts and bolts of the normal and agenormal treatments. These are two of the most fundamental tools we have in neurotherapy for tackling digestive health. For any of us practitioners, really mastering these protocols is, frankly, the key to seeing better results for our patients. Because, as we all know, everything starts with the gut.
So let's start with a core philosophy, the big idea that drives this entire approach. You see it right here. Almost every disease we encounter, whether it's metabolic, hormonal, or even mental health, can be traced back to the stomach. Now, this isn't just a saying. It's the bedrock principle that guides our entire treatment strategy. This is our clinical North Star.
Okay, so here's how we're going to break this down. First, we'll cover the foundation, why the gut is so critical. Then, we'll get into the mechanics of the normal formula for digestion, followed by the agenormal formula for absorption. After that, we'll see how they work together in the powerful NAN treatment, and we'll wrap up with the really essential stuff, protocols and, just as importantly, precautions.
So let's lay that foundation. The entire framework of neurotherapy is built on a single, powerful concept, and that is the body's absolute need for raw materials to function. This whole concept goes back to the pioneering work of Guruji, Dr. Lajpat Rai Mehra. His idea was profound yet simple. The body can't create something from nothing. Whether it's making thyroid hormones or key neurotransmitters, it needs the right chemical building blocks. And where do those blocks come from? They come directly from the food we eat. If you don't have those, the whole system starts to break down.
The easiest way to think about this is like a supply chain with 3 simple steps. Step 1 is intake, just getting the food in. Step 2 is preparation, which is digestion, breaking that food down into usable parts. And step 3 is delivery or absorption, getting those parts into the bloodstream. If there's a problem at any one of these stages, the whole system fails. This simple model is exactly how we're going to understand these two formulas.
And that brings us to our first point of intervention in that supply chain, preparing the raw materials. This is the digestion phase, and it's precisely what the normal formula is designed to address.
So what is the normal formula actually doing? Well, its main job is digestion, or pachan. The whole point is to stimulate our key digestive powerhouses, the liver, the gallbladder, and the pancreas, to get those crucial enzymes and bile flowing. This ensures that complex things like carbs, proteins, and fats get broken down properly into their simplest forms: glucose, amino acids, and fatty acids. So, if we go back to our supply chain analogy, the normal formula is basically the processing plant. It takes all the crude materials we eat and refines them into the standardized, ready-to-use parts that our cells are waiting for.
But, having a warehouse full of perfectly prepared parts doesn't do you any good if you can't get them to the factory floor. That's the delivery part of the equation. That's absorption. And that's where the Ajay normal formula comes into play. Its whole function is absorption, or avshoshan. It makes sure that all that glucose, all those amino acids and fatty acids that we just worked so hard to create actually make the leap from the intestine into the bloodstream. This step right here is where so many nutrient deficiencies really start, not from a bad diet, but from bad absorption.
So if the normal formula is the processing plant, then you can think of Ajay normal as the entire logistics and delivery network. It's the fleet of trucks, the drivers, the whole system that gets those finished parts from the warehouse out to the individual factories, our cells, that desperately need them to do their job.
Okay, so now let's talk about why these two formulas are so often used together. This is where you see the real synergy, where 1 + 1 = 3. And this just lays it out so clearly, doesn't it? One prepares the materials, the other delivers them. I mean, what's the point of perfect digestion if you can't absorb the nutrients? And you certainly can't absorb nutrients that haven't been properly digested in the first place. They are two halves of a perfect whole.
So the huge takeaway here is that when you combine them into what we call the NAN treatment, you're not just treating a symptom, you are correcting the entire nutritional supply chain from start to finish. And that is exactly why it is the go-to foundational therapy for the vast majority of digestive issues. It fixes the root problem. All right, let's shift gears to what is arguably the most critical section for us as practitioners. How to use this treatment, when to use it, and even more importantly, when not to use it. This is where theory meets safe, effective clinical practice. This is the one question that every single one of us needs to have the answer to instantly, without a second thought. It's all about patient safety and making sure we first do no harm. And here it is, the big red flag. Do not use this treatment for any patient experiencing loose motion,
period. The reason is simple. The NAN protocol works by increasing intestinal movement. In a patient with diarrhea, that system is already in overdrive. Applying this treatment will only pour gasoline on the fire. This is a non-negotiable rule. Now, what makes this formula so brilliant is how we can fine-tune it for specific conditions. Let's just walk through this. For something like diabetes or an autoimmune condition, we take out the spleen point to avoid overstimulating the immune system. For asthma or allergies, which often tie back to the liver, we remove the gallbladder point. For cysts or fibroids, we dial back the pancreas point from 8 to 2 to modulate hormones. And on the flip side, for hypothyroidism, we actually add the forethyroid point to give that gland direct support. This is your quick reference guide for customizing treatment. Okay, let's boil this all down to the absolute essentials you need to remember. 1. Gut health is everything. 2. Normal takes care of digestion. 3. Ajay Normal handles absorption. 4. Together they form the powerful NAN treatment. And 5. The most critical point of all. Always, always check for loose motion before you even think about applying this protocol. So I'll leave you with this one thought to take back to your practice. Knowing that this whole raw material supply chain is the foundation for health, how might this change your approach to the very next complex case that walks through your door, especially if it doesn't seem like a gut problem on the surface? Thank you so much for joining me for this deep dive. If you're looking for more advanced training or you just want to consult on a tricky case, Vishal Gupta at Santulan Holistic Solutions is a fantastic resource. All of his contact info is right there on the screen.